I would start out by introducing myself and saying my name and explain Mohs surgery to the patient, including the process of the procedure. I will look at her biopsy and familiarize myself with it so I can answer any questions. I will make sure the patient has nothing to worry about and inform them that the different types of cancer they may have. I will allow them to talk about their worries and concerns for the surgery and allow them to ask me any questions. Most surgery is used to treat skin cancer, and this surgery removes skin that contains cancer. The ultimate goal of this surgery is to only have cancer free tissues remaining. Basal cell carcinoma is the most frequently occurring form of skin cancer. The carcinoma is in the epidermis of the skin. The basal cell carcinoma rarely ever spreads from the origin and is not life threatening. Even though the carcinoma is not life threatening, it should be removed because it can be long lasting. The features associated with basal cell carcinoma are open spots, pink patches, red growths, and reflective bumps. The dermatologist will perform the surgery and I will assure her that she is in safe hands. Dermatologists are doctors who specialize in skin related conditions. Depending on how big the tumor is, the time for the surgery can range from 1 hour to 3 hours. You will be under local anesthesia, which means you will be awake for surgery. After the first layer of tissue is removed with a scalpel, which is the surgical instrument, a physician will look at the tissue under a microscope, which is basically plotting the tumor. During this time, you will wait in the waiting room, and depending on whether if the cancer is completely removed or not, you will either be done or go back to the operation table. Since the cancer spreads, they will see whether it has roots, and if it does, they will go back and remove the next layer of tissue until the area is 100% cancer free. The wound site will be kept covered and is not open to infections. I will tell her to make sure the spot of the incision remains dry for 1 day so it is not prone to infection, contusion, which is bruising, or edema, which is swelling. I will tell her scarring will occur and it may be permanent, which is a risk of the surgery. I will assure her that most patients do not have scarring for their whole life, and it usually goes away a month after the surgery. I will tell her to come back in a week in order to remove her stitches for her follow up.